Good morning, everyone. Thank you for coming out for my last policy announcement of the campaign. Today, we're here in our downtown to talk about my plan to deal with the overwhelming issues of homelessness and a palpable lack of mental health supports we're facing in our community. Before we begin, I want to give a special shout out to Ward 3 Councillor Reno Bordelin, who cannot be here today as his duties on the Windsor Police Services Board are keeping him busy on our behalf. I have been working with Reno on these issues as he has been on the front lines for the better part of his tenure on council. We have had many long and challenging conversations in trying to find a way to address the issues we see in our downtown core on a daily basis. Our campaign volunteers have been knocking on doors across the city, and the one prevailing thread that comes up so often is a difficult question of what are we going to do about our downtown. We need to make this a priority if we're going to ensure people feel comfortable and have them come down to enjoy all the great events like the Farmers Market, WIF, and so much more. We are faced with incredible social challenges in our community. Our mental health and addiction sectors cannot handle the huge surge of issues and people we have seen on the streets over the last 5 years. The issue is one plaguing municipalities across Ontario, Canada, and North America. We are not unique. We have seen different organizations calling for reform and changes to the Police Services Act and the Mental Health Act and how we deal with these issues from a policy perspective. We cannot continue to treat these issues as criminal in nature. We have heard over and over again from our own Windsor Police Chief stating that we cannot simply throw more officers at the problem. Chief Belair has been clear in stating that more police officers is not the solution. Our police department has been put in an impossible position, and at times those impossible positions can lead to tragic results. My heart goes out to the people we've lost and their families over the last 5 years. I also want to say thank you to our police department for continuing to work in impossible circumstances day in and day out. Police officers were never meant to deal with the issues we're seeing in our community today. I also want to take this moment to thank all the agencies in our community that come together in collaboration to work in very difficult circumstances to deal with these issues. The Windsor Police Services, Hotel Dieu Grace Healthcare, Canadian Mental Health Association, Positive Pathways, the Downtown Windsor BIA, Windsor Essex County Health Unit, Windsor Essex Community Health Centre, St. Leonard's House, Family Services Windsor Essex, Salvation Army, Downtown Mission, the Welcome Centre, and the DWCC and other residents groups regularly come together to work on these issues in meaningful ways. We often hear that nothing is happening or being done, but that is far from the truth. We have many capable, trusted community partners working to bring support to where it's needed most. But without a major shift in programming and resources, we will not achieve the results we all want to see, which leads to why we're here today. Today, I am announcing that a Holt Administration will establish a pilot program that will see a municipally funded mental health emergency room in our downtown core. This 2 to 3 year pilot project will bring together agencies already working in our core to collaborate and create a system that will be a leading edge program in the province. Throughout the pilot, we will gather data, present measurable outcomes, and share successes and best practices with the provincial government all along the way. With all we learn and develop over the impact of these 3 years in our community, we will invite the province to resource and use this program as a benchmark built right here in Windsor for investing in other communities facing the same challenges. The city will commit to working with existing organizations to set expectations and create a working model to be shared across the province. We will no longer stand on the sidelines hoping to convince other levels of government to do something. We will lead and show them what needs to be done and prove that funding these tested programs will come and will lead to desired outcomes. We have heard over and over again at the doors and in messages that we need to do something and we need to act. My opponent emphasized himself the need for a place where police can bring people in crisis. The need for this service is universally agreed upon. Today, we're acting on that need and creating a leading edge program. We will immediately see 2 very important outcomes. First, people will get the type of help they need. They will not end up in jail or at the ER simply to be discharged the next day. Second, the program will free up police officers who have been stuck in the ER for hours at a time. Police spend hundreds, if not thousands of hours per year idle at the ER simply tending to mental health patients who are waiting to be admitted. Police officers will now have more hours on the road, leading to better response times overall across the community. I am confident that with 2 area MPPs, we can get the attention we need on this issue and work with the province to step in and take over after 3 years. As a municipality, we are pledging over $9 million towards this project. That funding will come from the immediate halt to the Beacon Legacy project and cancelling the investment of new water slides at Adventure Bay. When we consider how important this step is to rejuvenating our downtown, there is no project that is more valuable or important than this one. This is the work that needs to be done. We need to make investments in our people. If elected, I will work in my first 100 days to get this project moving and create the necessary MOUs to advance this project immediately. I will also commit to working with and supporting the downtown mission to help find a suitable long-term solution to their space needs. The city should be more proactive in helping guide this process and be a part of the solution. I will also work with the mission to help create an outdoor area at that current mission location that would give clients a comfortable, dignified place to stay during the day, out of the sun and elements. This would immediately help keep people from congregating in other areas of our downtown. These were strong ideas brought forward by Brian Yeomans, who worked with the mission leadership to get approval from their board on these issues. There is no reason we cannot be a strong, trusted partner to work with the mission to achieve our collective goals. In closing, I want to emphasize that this pilot program will be a leader in the province and country. It is a solution that keeps human dignity at its core and offers tangible outcomes for all of us. Windsor will be on the front lines of policy and partnership development in addressing urban mental health issues that are in need of leadership all across our province and country. We have an amazing group of committed individuals from community agencies able to lead on these issues. When I think of the potential to create a program that will lead the province in addressing these issues we see in our core, I cannot imagine a better slate of partners than we have here in Windsor. It's time to show the rest of the province what is possible and how Windsor can be a leader.